Hey, um, I just had some thoughts and I kind of wanted to put it out there. I think maybe I'll write about it and put it on my blog. Um, but I kind of wanted to speak on like trauma bonds or like codependency, narcissism, in healthcare. Just being removed from that environment and then also going through my divorce, and especially recognizing that I'm a codependent or recovering codependent. It just seems interesting that tactics that business administration and hospitals, and even when, my brief 8 months in a skilled nursing facility, how they used narcissistic tactics to get the end result that they want. So like gaslighting, when you go above and beyond, it's enough. When you do exactly as what's in your job description, it's not enough. Or like guilting you by saying like you're not a team player. They just seem, it's a script, and I'm saying this about healthcare, but I guess this is for everybody, really. Is this something you see in other fields? Narcissistic tactics in order to get you to do more, keep you down, keep you exhausted, overextended. Because dang, man, what do you guys think? I've been looking for a job now since May. And just the idea of going back to being told what to do, or even being told I'm not enough. Being told I'm not enough. It just sounds soul crushing, you know what I mean? I've been out of it now for like 8 months though, so almost 9. But yeah, it just seems crazy. And then I'm not blaming like middle management, not your supervisor, not your store manager. They're just playing the game. They've got to pay bills, but it's coming from above, and it's nuts to think that, whatever's above them, they're people, but they're like, right? Especially in healthcare. I'm going back to it only because it's not a product. We're dealing with people. And then it's crazy to think that even now today, with as many people that are licensed nurses, that California is the only recognized state that has mandated ratios for each unit. And it has like a list of like things that are required per unit on what the ratio should be, nurse to patient. There are more nurses coming to California than there are leaving. When you hear that, you're like, why? Well, because, who doesn't want to come onto a floor and get 4 patients in an ER? When I was a traveler, nurses from other states would say, oh yeah, 8 patients in an ER is normal. What? Like, isn't that crazy? That's normal. I mean, and then when I go back to, like, that one case, I think it happened, like, 5 years ago? I think her name was Vaughn, and she worked at Vanderbilt. And it is a tragic story. I mean, she did give the wrong med, but from what I understand, she had, like, 9 patients. She was also precepting a new nurse. I don't know if it was a new nurse versus a new nurse to the department. And she was just doing her job like normal, and she overrid a med, which the process, that's like what you did. They've changed it now. Pharmacy needs to approve it, but that's because somebody got hurt. But even then, I mean, it's still not perfect, because at night, it's one pharmacy tech, or not even a tech, one pharmacist for the whole hospital typically. And that's like when I worked at Northridge, you know what I mean? And that's a big hospital. It's like a whole city block. But it's like these staffing, like in all departments, not just for nursing. I mean, and then, you know, I mean, these are just random thoughts, but I feel like it's something we should be talking about. I'm not saying we should be mad. I'm not saying that we should be rebelling. But I mean, like, we should be having calm discussions on what we're willing to tolerate, especially since we're the ones that are delivering the care. I mean, and for any other profession that feels like they're overextended, regardless if it's healthcare or not, I'm just more like, it seems interesting that there are these, like, invisible chains that nobody sees. And they're so distracted by their phone, the things that they want to pay for, which they don't even own really because they bought it on credit card. And it's like, a chain is a chain to me. They might not be on me, but they require me to continue working, to continue paying. That way I can keep it. And it's something I've always tried to get away from. But, I mean, I don't know. Maybe I'm just having, like, late night, like, random thoughts. But, I mean, is anybody thinking the same thing? Wondering the same thing? Like, where did all my control go? What happened? Why are we here? I think I've, like, kind of gone off track, but I think I needed to, like, get that out so I can go to sleep. So, I'm going to post it. Comment. Respond. However. All right. Thanks.